Hi, my name is Dr. Michael Scherer and welcome to my dental practice. In this video, we'd like to go ahead and take a few moments and talk about some various treatment options are available for my patients that are missing all of their teeth or soon to be missing all of their teeth. In many ways, when I have a patient that presents with no teeth in their mouth, maybe artificial teeth of some sort, that's a very common thing. But also, if you're a patient that's presenting to a dental office where you soon might be missing all of your teeth, meaning you've got potentially extensive gum disease, decay, broken down teeth, don't feel ashamed. It's a very common thing that I see in my clinical practice. As a practicing prosthodontist and board-certified implantologist, what we know is that tooth replacement, utilizing things like artificial substitutes, including a denture, overdenture, or a screw-retained prosthesis, is a very common thing. Rule number one, never feel ashamed about missing teeth. It's very common. There's approximately 60 million different individuals that are missing some sort of teeth or all their teeth in just the United States of America alone. You are not alone. When I have a patient that's soon to be missing all their teeth, we have a few different options of what we can do. In addition, we have some other options that are available for our patients that are missing all of their teeth as well. A huge part of my practice is treating patients that are soon to be missing all their teeth, maybe due to extensive gum disease, decay, cancer, trauma, injuries, accidents, you name it. How we miss and how we end up losing teeth is a huge diversity of how we do so, all the way from gum disease to what I just mentioned, trauma and oral cancer. Some of these things that we'll be talking about in this video, especially about how we end up losing teeth, is additionally covered in a book that I wrote, Lost Your Teeth But Not Your Appetite. It's available on Amazon. Make sure you check it out. In the book, I go into a little bit more depth and detail, but I'll cover a lot of the very important points and factors today. In this video, number one, when somebody thinks about missing or soon to be missing all their teeth, the first thing they think about is, oh my gosh, dentures. A denture is not necessarily a scary thing. It can instantly garner what grandmama had on their nightstand, or maybe your uncle that was just in fits, always complaining about something hurting, can't really bite properly. A denture can do all those things. I treat a lot of patients in my practice with plain old dentures, meaning that it's not a sentence. It's not one step closer to the grave. I know some dentists that are out there say, gosh, I never treat dentures. I just don't think that they're very good. But to tell you the truth, I treat a lot of patients with dentures. Now, most of the time, I'll end up treating a patient with a denture for the upper. And that's what a denture looks like. It's not something to be super scary. You can see it here on the picture. We have a patient with an upper denture, a set of dentures, a lower denture for their lower jaw, and this is them putting their teeth together. When done properly, a denture can work pretty well. The biggest challenge, though, of a denture, it's suctions. Pop it in, or on the lower, when you have a denture in place, it goes in the mouth like that, and it gives the patient restoration of their teeth. Now, one of the biggest challenges that we've always had with plain old dentures over the years is the fact that they're just suction cups. Meaning that if you don't have good saliva in your mouth, you don't have a lot of liquid, the suction cup doesn't work very well. In this video, we're talking a little bit more specifically about full replacements. And generally, full replacements are broken down into 3, maybe 4 different categories. Category number 1, the regular complete denture. Upper and lower, patient can go ahead and bite down and have full replacement of all their teeth with an upper and lower denture. Now, as mentioned before, one of the biggest challenges of an upper denture or lower denture is it was only for suction. So I can look at a patient in the eyes and look at an upper denture and promise to my patients that it'll look good, feel good, comfortable, it'll hold pretty darn good. Chewing will take some time, but I know you'll get there. So an upper denture by itself, without any sort of implant studs or any partials, can be a pretty decent option. Now on the lower is a much different situation. The lower tends to move around and flop around on you. And what happens is that without dental implants or just a lower denture by itself, it can really move around. So when you smile, the teeth move. When you blow a kiss, the teeth move. When you stick out your tongue or try to say things like these and those, or even be able to go ahead and laugh in a movie theater, the tongue pushes out forward, which causes the teeth to really fall out. And what happens is over the years in dentistry, we figured out different ways of anchoring a lower or upper denture that may be really loose. We started out by using natural teeth, kind of like on a partial, but then we found out that holding on to natural teeth can also lead to decay and gum disease. Dental implants came on board here in the United States many years ago. And even in the early 80s, this is when they really started to go ahead and take off. Dental implants are essentially like a titanium post that goes into the gums or the jaw that allows the denture to snap into place. And what happens is that if we take the denture and add a few implants, whether it's 2 implants, 4 implants, or more, it converts a denture into something called an overdenture. An overdenture is essentially just a plain old denture, but you add a few different implants into the gums, into the jaw, so that way it can allow the denture to snap into place. And part of the reason for that is it can be very efficient, especially by taking a patient that's been wearing a denture for years. Like if my patients have dentures, they come into the office, typically they're healed pretty well. And it can be a pretty low invasive, minimally invasive procedure. It's still a surgical procedure, but very minimally invasive. We can place dental implants and then even potentially connect it to the denture the same day. So a patient can come in, I can place the dental implants, and then even snap the denture in so that way it's functional from day one. Now, typically that's going to be more often on the lower than on the upper, just due to anatomy and jaw bones. But that being said, it is an option for many of my patients. Most patients, though, tend to go ahead and still have some sort of teeth in place, or maybe their bone is not ideal. In those situations, we'd want to take the more conservative route, place the dental implants, wait for them to heal, and then 2 to 4 months later, after everything is healed, then we go ahead and we start working on the teeth that snap into place. It takes a little bit longer, but sometimes the tincture of time is the best medicine. Part of the reason of why we consider dental implants for an overdenture or allowing our teeth to snap into place is my patients that don't have the snaps. As I mentioned before, it just kind of flops around all over. And this is a patient before I treated him with dental implants. Smiling, the denture moves backwards. Blowing a kiss, the denture moves side to side. Puckering or talking, sticking out their tongue, and even challenge yourself watching this video. Try talking. And watch, maybe your spouse, your sister, your brother, mother, etc. And watch how much the tongue moves while you're talking. Now that can be a little bit weird because what happens is you're like staring at their teeth, but try it just once and you'll notice that this is not an uncommon thing. But the straightforward adaptation of taking the denture and having a snap where the teeth snap into place with titanium implants and with locator abutments that allows the denture to anchor into place, giving the patient a huge amount of improvement and satisfaction. And what happens is that situation, when we go back and just kind of talk a little bit about adding the implants, it can be done with 2 or 4 dental implants. And in this case, and in this model, I've got 2 dental implants. In other situations, I can go ahead and place 4 dental implants. Now you say to me, but gosh, doctor, 4? That sounds better, but it sounds a lot more expensive. Sometimes it is. The reality, though, is it that much better? I'll put it to you this way. Not for every patient. 4 is not always better. But for some patients, or even a lot of patients, maybe there are younger patients, strong jaws, big musculature, maybe they want to chew harder or crunchier foods, and if their anatomy allows it, where I can place dental implants in the back of the jaw or on the upper jaw in the back, it takes a snap-in denture with 2. The snap-in denture with 2 wiggles just a little bit. If you watch right here and I just kind of wiggle it, a locator overdenture or a 2-implant overdenture is meant to wiggle just a little bit by design. However, if we place 4 dental implants, especially in a situation where we have 4 implants, 2 in the back, 2 in the front, like I did on this patient, same snap, same tongue, same lips, but the big difference is no movement. I push really firm, no movement whatsoever. And that's essentially by mechanical engineering. When we put 2 snaps in the back, it prevents it from rotating. Simple. Now, in some situations where a patient may have favorable jawbone, a lot of times we can go ahead and very easily and minimally invasive place dental implants in the back, maybe even potentially at a slightly reduced cost, optionally for you, your mouth, and with the dentist that you're working with. As a result, I used to do a ton of just the 2 implants in the front, and I found out I got pretty good results. But as I started to go ahead and do more implants and add 2 in the back, or potentially on the upper, adding somewhere between 4 and 6 implants, my patients became really happy. As a result, sometimes what happens too is that nothing is perfect. We do dental implants, and occasionally years down the road, one just may go bad. Maybe you start losing bone around it. It can happen. Complications happen. Nothing is perfect, always, from day 1 to day whenever. What we know is if we plan for future, meaning that if I place 4 today, and gosh, maybe 10 years down the road, one decides to just go, maybe my bone starts to go away from there, I've got an option with the other 3 or with the other 2. If I only have 2 and one goes, it can be a much bigger deal. Same thing is true on the upper. Thankfully on the lower, we don't have that many complications long term. But on the upper, complications are a little bit more common. It's a little bit trickier to treat implants on the upper for snap-in teeth because the bone is a little bit softer, and a lot of times our patients don't really have ideal bone for the upper. But whenever possible, if we can place a series of dental implants on the upper jaw, whether it's 4 implants, which is typically my minimum, or somewhere between 4 and 6 implants, like shown here on this model, that's pretty ideal. As a result, if I can get in 4 implants, I can give my patient a palate-less snap-in denture or overdenture, where it snaps in, and it gives my patients a nice open window where they can go ahead and feel the roof of their mouth. Increases taste, sensation, function, and ultimately, when my patients bite down into something in the front, very minimal, if any movement at all, it feels a lot more natural than going something like this, where you can see the size and bulk difference between a plain denture and a upper overdenture. What happens now is that when dental implants are done properly, they work really well long term. On the upper, I may place somewhere between 4 and 6 implants, adding a couple of extra implants as an insurance policy, just in case maybe one goes bad down the road. I've got 5 others and such. Now that's a decision I make. Some other dentists, they feel pretty comfortable with just 4 implants from the start, perfectly fine. Sometimes what we end up doing just to keep them healthy long term is we may use something like a bar to splint all the implants together to control the biting forces. The final treatment options that we have available to us in full mouth restoration is something that we call a all-on-4 or all-on-X. An all-on-4 style restoration is a screw-retained set of permanent teeth. What this comes down to is that we have the ability to go ahead and make the teeth non-removable to the patient. Where the first 2 treatment options, what we went over, we have a plain denture, which is removable by the patient, suction cup. Then we have the snap-in overdenture, option 2, removable by the patient, intended to be removed every day and kept clean. And then additionally, we have our third option, which is the permanent teeth, which is the all-on-4 or all-on-X procedure. Essentially taking a patient with broken down teeth, doing a same-day procedure of converting the patient from natural teeth over to implant teeth, all in one visit. Same-day dentistry. Teeth come out, dental implants go into place, and a temporary permanent bridge is placed. Temporary permanent meaning that we have a little bit of a miracle that day when implants or teeth come out and implants go in As long as the implants go in sufficiently, everything goes well with the procedure, we can put on temporary teeth that are the shape of the permanent teeth, maybe a little bit shorter, maybe a little bit less teeth than you'll have in the permanent, but it'll give you something where there's nothing touching the gums or very minimal area touching the gums. Patients have to be gentle and careful with those temporary prosthetics while they're healing, but are pretty comfortable during those 2 to 4 months of healing. Versus if we have to go towards a snap-in denture and we can't necessarily connect them the same day, we have to wait because they're bone or something maybe not ideal, yeah, we might have to be working with a temporary denture for 2 to 4 months that flops around a lot. Versus an all-on-4 or all-on-X procedure, you don't have to worry about that. You have teeth that are permanently installed the day of the procedure, in most cases. On the lower jaw, generally happens almost all the time. On the upper jaw, generally happens about 90 to 95% of the time. Sure, there's going to be about 3, maybe 5, maybe 8% or 7% of the time where we can't. Make sure that you go ahead and check with your dentist. There are certain situations of bone anatomy where it just can't happen that same day. But ultimately, once it's all finished up, a permanent restoration that the patient never takes it in, never takes it out is pretty ideal. The only challenge there is it can be a little bit harder to keep clean. So we want to make sure that my patients can get up underneath the edges of the restoration, cleaning it with like a water sprayer device, something of that nature, or using proper floss instruments to clean underneath there. But ultimately, it can be a wonderful prosthesis, and when done properly, is pretty effortless to the patient, feels just like natural teeth. So those are our big 3 main options. Number 1, a plain old denture, no implants. Number 2, a snap-in denture, we call a locator overdenture. Or option number 3, something we call an all-on-X or all-on-4 restoration. As mentioned earlier, there may be a 4th option, which is something that is a little bit more challenging and technical to do, but it's essentially implant bridges. We restore a series of dental implants, usually somewhere between 6 and 8 dental implants on the jaw, on the lower and the upper, and teeth that are glued or screwed into place that are very natural. The big difference is that we have to make sure that the implants are placed pretty precisely, so additional implants are needed, very precise surgical procedures. It can turn out very good, but also it can be one of the more pricey options as well. In addition to that, most patients, at least in my clinical practice, end up typically with the snap-in teeth, the overdenture, or with the all-on-X or all-on-4 prosthesis. I do have quite a few patients that end up with just a plain denture, especially on the upper, because they can be extremely comfortable on the upper alone. But in those situations, most patients that end up with just a plain upper denture would typically also go towards a snap-in denture on the lower. So you can cross-combine a lot of these. I can have a patient wearing an upper plain denture, and then a lower snap-in, or I can have a patient wearing an upper snap-in denture and a lower fixed all-on-4 or all-on-X style bridge. Perfectly normal to mix and match all of those things. In addition, the 4th option can also be mix and match. This one is what we call like an FP1 or screw-retained crown and bridge style prosthetic. Cost definitely increases when you go from denture, which tends to be the cheapest. The overdenture or snap-in tends to be more the middle ground option. And then one of these permanent style restorations tend to be the more expensive one, which the traditional crown style bridges tend to be the most expensive because of the complexity and number of implants. A lot of patients end up with the all-on-4, all-on-X restoration because it can be a happy middle ground between, doctor, I don't want something that comes in and comes out. I want permanent teeth. But I don't want to spend as much money that is necessary to do that super complicated crown and bridge. And I'm kind of looking for something maybe that can be done in a same-day procedure. All-on-X or all-on-4 restoration. But what I found from experience is I do treat a lot of implant overdenture patients or locator overdenture patients because maybe a patient doesn't necessarily want to go ahead and go down the direction of something more costly or permanent. Maybe they want to take their teeth in and out to be able to scrub them is clearly an option. What I found here in my clinical practice and my combined prosthodontics and implantology practice is I believe that we talk to patients about all of their treatment options. These models are essentially what I'll talk about in every clinical appointment, so that way I always believe in educating patients learning together, listening to stories, and trying to find out what is your best treatment option. What do you value? What are you looking for as a patient? Most importantly, when we go ahead and we sit down and learn and talk about things, we can go ahead and dial in and make sure that we're choosing the best treatment option for my patients. This is Dr. Michael Scherer coming in from my dental practice here in California. I look forward to go ahead and hearing about your stories. Feel free, message down in the comments below if you have any clinical questions or anything that may come up. I look forward to seeing you next time.